Good morning, everybody, and welcome to this meeting of the NHS Commissioning Board. True to the task that we set ourselves at the outset of being open and public and transparent in the way in which we work, our session of meetings every 6 weeks or so focuses around this, a meeting in public. Not a public meeting, it's a meeting of the board, but it's held in the presence of members of the public, and it's web streamed both live and then stored on our website for future reference. It's not the only way in which we do business. We also work using both non-executive members of the board and the national directors together in developing the board's business, so that by the time business comes to the public meeting of the board, we hope that we as a board have already given it a great deal of thought and a great deal of deliberative time. We will also, after this meeting, go into private session to look at matters which have serious elements of confidentiality around them. They may, for example, relate to human resources issues or to business that is still under development and for subsequent publication. So let me start by welcoming members of the public who are with us this morning, and thank you very much for coming to join us. I have no apologies for absence from the meeting this morning. We have a full house. I'm going to invite declarations of interest in the business under consideration this morning, and I start with my own, which is in respect of item 6, the design and designation of academic health science networks. And my interest is that I am a member of the board of UCL Partners, which is a candidate AHSN.
Chair, could I also register an interest on item 6 as non-executive chair of the University of Birmingham and its pro-chancellor?
Can I register an interest in item 6 in that I've been approached by UCL Partners to get engaged in their mental health programme?
Right, thank you very much. We will take on those registrations of interest. I ought also to draw to everybody's attention that there is no fire alarm scheduled for this morning, and in the event of the alarms going off, we need to exit the building by the fire exit, which is immediately behind me, and we will be escorted by staff round to Fitzroy Square should that happen. I'd also just like, before we kick off formally this morning, to issue my thanks on behalf of the board to an organisation called Changing Lives, who yesterday hosted some of us as members of the board to an afternoon session with people with serious learning disabilities. It was important for us, I think, to have an opportunity to engage with people whose interests are sometimes overlooked in a comprehensive national health service, and whose desire so strongly expressed to us was not just not to be overlooked, but not to be pushed into specialist services, but to be regarded as part of the mainstream of care and provision within the NHS. And we were, I think, very impressed by the organisation of the afternoon and also by what we heard. I just wanted to put that on the public record this morning. We have now the minutes of the last meeting. Can I ask whether my colleagues are happy, first of all, to endorse them as a report of the last meeting? Yes, you are. Thank you. Are there any matters arising that are not otherwise on the agenda? I've not had any prior notification. No, thank you. May I then move to the Chief Executive's report? David, over to you.
Thank you, Chairman. Well, we are now moving into that period where a lot of the development work is being done, but now we're starting to think about real decision making about the future of the NHS in next year and the subsequent years, and that's reflected in what I'm going to say this morning. The first thing and the most obvious one is that since the last meeting, the publication of the mandate, a really important step, I think, in the changes of for the NHS, a mandate which we welcomed on the day, which I think gives a good balance between setting clearly out what the government's objectives for the NHS are, but giving enough space for the commissioning board and clinical commissioners to really start to take forward things locally. So I think it's a really positive outcome in relation to that mandate. Next week will be a particularly important week for the NHS. The Commissioning Board will publish its planning guidance, the allocations, and the department will publish the arrangements around the tariff. All of those three things are vitally important in a sense to create the framework by which local commissioners can start to put their plans together for the next year or so. And when we make the announcements and we take that forward, I think we're attempting to get a good balance between continuity and safety of the service, but also some more sort of radical elements that herald the kinds of changes for patients that we all want to see. Last week I also saw the publication of the strategy for nursing. The Chief Nursing Officer did a huge amount of work last week in relation to it. Many of you will have seen her on various news programmes and sitting on settees and all the rest of it. Really important document which has come out of a lot of consultation with nurses and others across the system. A really important kind of mechanism, in a sense, to ensure that care and compassion is really central to the way in which we take services forward in the future. It's been well received by nurses on the ground. I think it sets out some very ambitious objectives for us, but I think starts to turn a situation where nurses can start to really take a leadership role in delivering services for us across the system. The Department of Health published its response to Winterbourne View, a set of really very difficult things for the NHS to deal with. And reflecting on what Malcolm said earlier, part of our thinking around Winterbourne View and about the way in which people with learning disabilities are supported and helped and developed was the meeting that we had yesterday with a group of people, their carers and advocates. And I think for all of us who were there, it was a very inspiring thing to do. I think an important way in which the Commissioning Board itself at a national level can start to work to discuss directly with people what their aspirations are. And I think the overwhelming thing that came for me with it was, first of all, there are some really practical things that we can start to do. And we've committed to a more ongoing relationship with this group of individuals. But there are some really kind of concrete things that we can do. There's a whole series of issues around data that we can deal with. One of the things that they were saying to us was that very often, if you have a learning disability, you turn up into an organisation and no one understands you or what your needs are and all the rest of it. So some very simple things around data that we can do to help and support, flag those things. There's a whole series of things that we can do about the commissioning of specialised services, whether that be for people with learning disabilities or for general services, and engaging people with learning disabilities in the commissioning and monitoring of those services, I think, will be really important. And there are some concrete things we can do as an employer in terms of employing people with a learning disability to support and help. And I think overwhelmingly from all of that came that the people with learning disabilities wanted to be a part of the solution and not a problem. And I think that came over really, really well. And in terms of the way we work as a board, working in partnership with patients or service users or whatever, is going to be a really important kind of signal to the way that we operate. Since the last meeting, we've had the first session of the Commissioning Assembly. Just to remind members, we worked with the CCGs over a period, all of the CCGs over a period, to think about how we can collectively start to work together. And what came out of that was the idea of a commissioning assembly, clinical commissioning groups and commissioners from the Commissioning Board coming together to think about things on a corporate level. I think we made a really good start, a huge amount of enthusiasm, in a sense, to see the commissioning system as one system. Absolutely that people have local responsibilities and local powers and all the rest of it, but there are some things that we can do stronger together collectively. I think that came out of that very powerfully. And you can see, I think we're going to have a report from the CCG authorisation subcommittee in a while, but huge progress I think has been made in relation to all of that. That's, I think,
very much.